Welcome. If you're watching this, you've just had a ureteroscopy, a procedure to remove a stone from your kidney or ureter using a small telescope passed through the natural urinary passage. No cuts on the skin were needed. In many cases, a small soft tube called a ureteric stent is placed at the end of the operation to help the ureter heal and to keep urine draining smoothly. Your surgeon will have explained whether a stent was placed in your case, and when it will be removed. The surgery is done. This video will walk you through what to expect over the next 1 to 2 weeks so you feel confident at home. After ureteroscopy, it is very common for your urine to look pink or red for the first few days. This is normal. The inside of the ureter has been instrumented and a little bleeding from the lining is expected. If a stent is in place, you may see streaks of blood come and go for as long as the stent is in, especially after walking, exercise, or a long day on your feet. This is expected and not a cause for alarm. Drink plenty of fluids, aim for about 8 glasses of water per day. This helps flush the system and reduces the chance of infection or clot formation. If you notice your urine turning dark red, or if you pass a large blood clot that blocks your flow, contact the clinic. Most patients recover quickly from ureteroscopy. Here is a simple guide for getting back to normal activity. Day 1 to 3, take it easy. Short walks around the home are fine and actually help. Rest when you need to. From the end of the first week, you may return to desk work and most light daily activities. While a stent is in place, avoid heavy lifting and strenuous exercise. The stent can rub against the bladder lining when you exert yourself, which causes discomfort and more bleeding. Once the stent has been removed and any residual soreness has settled, you can return fully to your usual activities, including exercise. If a stent has been placed, it is not uncommon to experience what we call stent symptoms. These can include needing to pass urine more often, a sudden or strong urge to go, a mild burning sensation, and a dull ache in the lower back or bladder area that is sometimes felt at the end of passing urine. This happens because the stent sits with one end in the kidney and the other in the bladder, and the bladder feels its presence. These symptoms are temporary and settle completely once the stent is removed. A few simple habits can help. Drink steadily through the day rather than large amounts all at once. Reduce caffeine and alcohol while the stent is in, as both can irritate the bladder. Take the medications we have prescribed, these help ease stent symptoms. And avoid constipation, since straining puts extra pressure on the area. If no stent is in place, most discomfort settles within a few days. Most of recovery is straightforward. But please contact the clinic promptly if you experience any of the following. A fever above 38 degrees Celsius, with or without chills. This is the most important warning sign after a stone procedure and may indicate a kidney infection that needs urgent treatment. Severe pain in the back or side that is not controlled by your prescribed pain relief. Inability to pass urine. Heavy bleeding, bright red urine with large clots that does not settle with rest and increased fluids. When in doubt, call us. We would always rather reassure you than have you wait too long. Recovery from ureteroscopy is usually quick. Most patients feel back to themselves within a few days, with any stent symptoms easing the moment the stent comes out. If a stent was placed, we will see you about 1 to 2 weeks later to remove it. Removal is done with a short cystoscopy, a thin telescope passed into the bladder, and takes only a few minutes. We will decide together whether to do it under local anesthetic or with light sedation, depending on what suits you. After that, we may arrange a follow-up scan to confirm the stone is fully cleared and the kidney is draining well. Drink well, take it easy in the first week, and do not hesitate to reach out. Take care, and we'll see you at your follow-up.